Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health. Questioning for this department will proceed in a global manner. The floor is now open for questions. The Honourable Member for Union Station.
Thank you. I'm going to start by asking some questions of the Minister regarding vacancies specific to nursing. Can the Minister share the total provincial-wide nurse vacancy number? What is the number? Is it 2,400? Is it 2,500? And what percentage that is exactly?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. With regard to the member for Union Station's question, I seek clarification. Which years is the member wanting the number of vacancies and the percentage of vacancies? For which year, please?
The Honourable Member for Union Station.
The most current and up-to-date information that the Minister can provide, is what I'm seeking. So the most current information that the Minister would have available to her regarding the vacancy number and what percentage that is.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I would like to take this question under advisement, please.
The Honourable Member for Union Station.
Can the Minister advise whether or not she be able to provide that information in today's session, or can we expect it in the next day or so, or sometime after that? Some clarity around the timeline would be appreciated.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. We commit to having that information available at estimates tomorrow.
The Honourable Member for Union Station.
I thank the minister for that commitment and clarity around when that information will be provided. I'd like some clarity around the attrition rates currently. So we all know, we're well aware that we have lost nurses from the healthcare system due to retirement or burnout in some cases. Certainly during the pandemic, we saw that, and we continue to see that. I'm wondering if the minister can provide what the current annual attrition rates are for nurses leaving our health system. And if the minister also would have any additional information in terms of whether or not the attrition is specific to retirement or burnout, or if there's any indicators that they have clarity around, that would be appreciated as well.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question. I would ask to take this question as well under advisement, and we commit to having the information available for the member at tomorrow's estimates.
The Honorable Member for Union Station.
I thank the minister and her staff for committing to take that under advisement and being willing to provide that information tomorrow at estimates. I appreciate that. So in regards to nursing, we know that there's been an increase in nursing seats in post-secondary institutions, but we also know that nursing seats were actually cut under this government. 2019, I believe it was, that there were 75 nurse training seats cut from Red River College. And so now when we look at what's going on in our healthcare system with a nursing crisis shortage, and we see the challenges our healthcare system is facing, I'm wondering if the minister can provide whether or not she thinks that we're currently training enough nurses. So I would make the point that we are well aware, I am well aware of what this government has announced it's doing in terms of adding additional post-secondary nursing seats. So I'm not seeking clarity in terms of what those historical announcements have been. What I am seeking clarity around is whether or not the minister, through her own observation and understanding, and I'm sure the minister gets reporting from her department on this issue, does she think that there are currently enough training seats for nurses? And a follow-up to that would be how many fewer nurses graduated over the past 7 years? Again, we know that those 75 seats were cut at Red River. While there have been some seats added back to that post-secondary institution, it doesn't make up for that cut of 75. So I'm wondering if the minister can also tell us how many fewer nurses have graduated over the past 7 years due to the decrease in the nurse training seats that took place.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question, and I would direct the member to the estimates for the Department of Education to obtain exact numbers about training seats and how many more, because those numbers and training seats are allocated through the Department of Advanced Education. But I do thank the member for the question, because it gives me an opportunity to talk as well about what we are doing to help nurses to get licensed here in the province. And our Health Human Resource Action Plan is the foundation of all the work that we're doing. And there are 3 pillars. Training is just one pillar. Recruit and retain is also very, very important in terms of stabilizing the number of nurses we have in the system. So again, training is just one component of that, but I can share with the member that the challenges that we're having here in Manitoba are not unique to Manitoba. This is being faced across the country. I talk to my colleagues who are ministers of health in other Canadian jurisdictions and even globally, and they're saying they are experiencing the same challenges. So we're currently supporting nurses through a $123 million investment. And how we're doing that is offering a new hourly premium for nurses who work weekend hours, a new annual payment for nurses who hold the equivalent of a full-time position. As this helps to build more stability in the workforce, we're reimbursing the costs of nurses' professional licensing fees, an annual incentive for nurses who are eligible to retire but choose to remain in the workforce for up to an additional 2 years, of course, to retain valued expertise and build capacity as new nurses are recruited into the workforce, an incentive for nurses who have previously left the profession but choose to return to the workforce, a new refer a nurse program for current nurses who refer a prospective nurse to a Manitoba employer. We're developing a provincial float pool to support nursing staff needs across the province. We've added a travel nurse incentive, which will provide an additional hourly premium for nurses who travel to work in remote locations, and a wellness incentive, which adds additional funds to the health spending account of full and part-time nurses to help to cover the cost of eligible expenses. So I do also want to share that other nursing initiatives, because the member mentioned that we our efforts to get to the 400 new nursing education seats. $19.5 million has been invested to date to add 259 nurse training seats at 5 post-secondary institutions, $4.3 million for 37 additional nurse training seats at University College of the North. We've also worked with our post-secondary institutions to allow for an additional intake of nursing students, raising the total to 3 a year. And so a lot is happening there for our nurses, but that are here in Manitoba. But then we look at the nurses, the individuals who are here in Manitoba who came with hopes and dreams of following working in the profession they were in their homeland, that are not working as nurses. And so our government had to take action to work with the College of Registered Nurses of Manitoba to establish 7 areas of improvement for internationally educated nurse pathways towards licensure based on an interjurisdictional comparison. I want to be able to share that because I've heard from so many internationally educated nurses right here in my office. They've sat and shared their stories of
The Honorable
frustration.
Minister's time has expired.
So I didn't.
The Honorable Member for Union Station.
Thank you, Chairperson. I didn't hear in the minister's response whether or not she thinks that we're currently training enough nurses. I was pretty clear when I said that I'm well aware of the government's historical announcements around their initiatives in this area. And I don't think that it's a good use of time in committee necessarily for the minister to repeat announcements that she's, brought forward many times before, including in previous estimates committees. But I didn't hear an answer from the minister in regards to whether or not she thinks that we're currently training enough nurses, which is concerning to me because, the minister has redirected me to get the information around nurse training seats from the post-secondary education department. And I can appreciate where the minister is coming from with that feedback. However, as the Minister for Health, one would think that she would have a good understanding, a sound comprehension as to whether or not we currently have enough training seats for nurses. That is certainly within her purview. And I didn't get a clear answer from the minister in regards to that question, which is a bit disappointing, but I will surmise from the minister's response that she does think we have enough training spots available for nurses at this time. I don't know that is what nurses on the front lines or even those folks who deliver the training would necessarily say, given the shortage that we have. I think that most folks will point to historical cuts to training seats and highlight that as a big concern and having a real impact on the number of nurses we currently have in our healthcare system. But I'll leave that question as the minister, I don't think is going to provide any clarity for me there, unfortunately. I do think it's really important that we get a sense of what's going on with the current number of job postings for nurses. I've heard anecdotally from nurses that there are job postings that have gone unfilled, that have been posted for quite some time, and or have needed to be reposted. This is an area of significant concern, and I'm hopeful that the minister can provide clear information around this. So, can the minister provide what percentage of the current nurse job postings right now are reposts? What percentage of the current nurse job postings are open postings with no application deadlines? Which of these postings are for multiple openings? And in that case would be because they simply can't fill them. If the minister can provide clarity around this area in terms of nurse job postings, that would be great.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for the question. That information is gathered by Shared Health. So we will endeavor to obtain that information from Shared Health, and I will take the question under advisement. Thank you.
The honourable member for Union Station.
Does the minister have a timeline perhaps of when that can be provided? I know that maybe it's a bit different having to get that information from Shared Health, but hopefully that'd be readily available to them. So can the minister provide a bit of clarity in terms of when we could expect that information?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. Again, the information is held by Shared Health, and the member is asking about job posting for nurses across, I gather for nurses across the province. We have over 14,000 nurses in the health system. So if we are going to be looking at job postings, and if the member can clarify, is it for a specific time period? Again, in the previous question, the member said it was for the year prior. So is it for a 1-year period, just so we can put some a timeline around this? Because of course, as I said, over 14,000 nurses are in the system. We will have to go to Shared Health to gather that information from every program area's human resource department. So the ability to act on this very quickly will depend on the timeline that the member has in mind. If I could get some clarification, please. Thank you.
The Honourable Member for Union Station.
If the minister could provide the most current and up-to-date information around those percentages and the details around, which ones are reposts or open postings with no applications, with no application deadlines, or postings for multiple openings because they can't be filled. So I'd be looking for the most current, up-to-date information possible. And that would be, the most recent reporting that's available through Shared Health.
The Honourable Minister of Health.
Based on the clarification from the member for Union Station, we will endeavor to get this information tabled and after taking it under advisement within the reporting timeframe. And I think that is 30 days, if I'm not mistaken, Mr. Chairperson.
The Honourable Member for Union Station.
Thank you to the minister for endeavoring to provide that information. And I might go back to that. I'm just sitting with something, and I might go back to that and ask for a bit more clarity beyond that window. But for now, I do appreciate the minister's commitment to that. Can the minister undertake to provide a list of all technical appointments in her department, including names and titles?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm pleased to respond to the member's question. The number of technical individuals is 3. I have a senior advisor, an executive assistant to the minister, and a special assistant to the minister.
The Honorable Member for Union Station.
Can the minister provide their names?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. The 3 individuals include Matthew LePage, who is the senior advisor, Tyler Thomas, who's the executive assistant, and Vanessa Weeb, who is the special assistant to the minister.
The Honorable Member for Union Station.
I thank the minister for that clarity. Can the minister undertake to give an organizational chart that lists all employees and program areas?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. If I would like to direct the member to the Supplements Budget 2023 document, page 14, has the org structure for Manitoba Health as of April 1st, 2023, with the reporting framework and the title of the various units within Manitoba Health, Mr. Chairperson. Page 14.
The Honorable Member for Union Station.
I thank the minister for that direction. I'm just wondering if she can undertake to provide an organizational chart that provides greater detail than what is already in the supplementary estimates book, something that would list out all employees, various titles, and program areas. Thank you.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. With regard to the question, no single document or org chart exists that lists the titles and names of all over 700 employees in Manitoba Health. It does exist at a unit, branch, or program level. So this would be a significant ask in terms of collating all of that information for 700 people. As well, there's an issue of privacy. The members asking for the names of the individuals that are in these positions. They are civil servants. And so that would require a determination by the civil service commissioner as to whether the names of individuals who are in these positions can be released. But we will take this under advisement. We will do the appropriate checks with individuals who can let us know about the privacy issues, and we will endeavor to make that information available.
The Honorable Member for Union Station.
To be clear, I'm not seeking any information that would, potentially compromise, obviously, the privacy of civil servants. An organizational chart that lists all employees wouldn't require their names, wouldn't require that personal identifying information. Just roles, employee roles, I think would be more than adequate. And identifying the program areas. So I appreciate that the minister is willing to take this under advisement. I recognize that perhaps it will take some time to collate all that information appropriately. I do think that, there's obviously hundreds of employees. However, being able to bring that information together in a way where, I can see and we can see the organizational flow of what is going on would be very helpful. And it's really good information. So the minister's already indicated that it does exist, maybe not necessarily all in one place right now, but certainly appreciate the minister being willing to take this as an undertaking. And I respect the confidentiality of civil servants in terms of them not necessarily being identified. And that wasn't an expectation of mine. So I thank the minister for that. And I look forward to at some point receiving an organizational chart that lists employees and program areas. I'll move on to vacancies in the department. This is an area of really big concern, actually. We've heard reporting around vacancies in the department, and as one would imagine, it can be very difficult to execute any strategy if there are significant vacancies in a department responsible for doing so. And so clarity here is very important, and I'm wondering if the minister would be able to today provide a list of all current vacancies in the Department of Health and to list those vacancies by program area. And if the minister could also provide what the current overall vacancy rate is in the department.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. With regard to the member's question, I do not have the breakdown at the program unit level. I do have the overall the member has requested. The total vacancy value of vacant FTEs is 217.16. However, 30 of those positions that are vacant are being transferred to shared health out of the department because when the focus of the department changed, there were a number of positions that are going to the Provincial Authority of Shared Health. And the overall vacancy rate is 26.7. Again, I don't have a breakdown available today, program area by program area, but we can take that under advisement. I also want to go back to the previous question raised by the member about the org chart. Just to clarify, it will not be just one chart that the member receives. It will be a series of charts by division or program area because we won't have one big chart. So I just wanted to clarify that so that when the information is forwarded, there's a concern that it hasn't met our commitment to provide a chart. It will be charts. Thank you, Mr. Chair.
The Honorable Member for Union Station.
I thank the minister for not only her response in terms of the overall vacancy rate. I believe she said 26.7% out of 217.16 available FTEs. And for clarifying that 30 of the vacant positions are being transferred to shared health due to some changes there, some structural changes. I might go back to that to get some more clarity around that, but I do thank the minister for that response and for clarifying that I'm going to receive several charts. I like organizational charts. I like that kind of documentation. So I'm not disappointed that we're not going to receive one giant chart. I'm looking forward to being able to examine the many charts that we'll be receiving. So again, I thank the minister for committing to provide that. I'm going to move on now to mandatory overtime for nurses. This is an area of deep concern, obviously, for nurses, but certainly the general public has a greater appreciation now for the impacts of mandatory overtime. We've heard stories of nurses across varying areas struggling to maintain any semblance of a work-life balance as a result of being forced to work mandated overtime. We all, I think, understand the increased risks in the workplace in terms of delivering quality patient care when nurses are forced to work mandatory overtime repeatedly. I mean, even just the challenges for nurses to get home safely after working, forced mandated overtime shift. We know that the burden of overtime, mandatory overtime, mandated overtime, has really been borne the brunt of that by nurses and other healthcare professionals, allied healthcare professionals as well, unfortunately. We, I think, all have an appreciation that nursing shortages have been so dire and are dire that this government has had to consistently resort to mandated overtime for nurses. We've seen the inappropriate use of mandated overtime as a staffing tool instead of the appropriate and adequate efforts being made to fill vacancies. And I've heard many, many times, I've heard from so many nurses in so many areas, the fear that they have of going into their shift and not knowing whether or not they're actually going to be able to get home, see their kids, follow through with plans that they have, or even personal appointments, medical appointments, because they might get stuck working overtime. We're talking about 16 hours in a row, 20 hours in a row. We've heard situations of nurses working 24 hours, really unsustainable levels of mandated overtime. Can the minister provide clear information around how many shifts, maybe the percentage of shifts that are paid at overtime rates because there aren't enough people being hired into vacant positions?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. So the question asked is the percentage of shifts paid at overtime rates due to positions not being filled. And the members asking for about mandatory overtime for nurses. Now, we capture overtime hours for nurses, but the number isn't divided between regular overtime or someone being mandated to work overtime. It's just one. It's just one metric. It's overtime hours. So I wanted to ensure that the member is aware that it's not captured as a percentage of shifts that were paid at overtime rates or that they were paid due to any vacancies.
The Honorable Member for Union Station.
I thank the minister for providing that insight. Does the minister have the information specific to what is available?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. We will take that under advisement and have it available for estimates tomorrow. Thank you.
The Honorable Member for Union Station.
My understanding, sorry, thank you, Minister, for agreeing to provide that information tomorrow. I appreciate that. I understand that overtime is now paid at double the regular rates because things have gotten so difficult in the healthcare system and so dire under this government that they've needed to change the rates in order to incentivize folks who are working overtime. Can the minister provide what percentage of hours worked overall? Actually, sorry, I'm going to reframe that. Does the minister think that given the amount of overtime that we know is being paid out, and we know that those numbers are significant, does the minister think it would be more efficient, like more effective for our healthcare system to train and hire more nurses as opposed to having to pay out these significant amounts of overtime? And I know I asked the minister previously whether or not she thought we had enough training seats for nurses, but I'm asking for whether or not the minister thinks that instead of, paying out these massive amounts of overtime costs, and certainly I'm not suggesting that the minister, turn off that tap altogether and then, those resources aren't there, because unfortunately, due to how dire things are in the healthcare system, folks are having to work overtime. But what I'm asking is, would it not be more efficient to train and hire more nurses? Does the minister not see that as a more efficient and effective path forward?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question. I know that the member worked in the health system as I did as well, and the commitment was there when the member worked in the system, and when I was there to train and hire more nurses. Our government has come through, Manitobans have come through a very, very difficult time of the pandemic, and all jurisdictions, provincially and across Canada and globally, are experiencing a nurse shortage. And, the last time I was at the federal, provincial, territorial ministers of health meeting, around that table, there was not one person that felt that they didn't need to hire another nurse or train another nurse. We all agreed that more needed to be done. And I was pleased to be the Minister of Health when we championed the Health Human Resource Action Plan. And again, it's not one platform that will address the shortage. It's the three that we've identified. Yes, we need to train nurses. Yes, we need to recruit. And yes, we need to retain. And that action plan is an investment of $200 million. And it's the $123 million for 9 nurse incentives to train, retain, and recruit nurses. And then it's the work of advanced education. I don't have all the numbers for advanced education, so I'll have to refer the member there to their estimates, but it's working collaboratively with the other departments and areas of government, that whole of government approach to addressing an issue that impacts every Manitoban, which is healthcare. And so ensuring that advanced education is increase in the seats so that we can train. But it's not as simple. I've had people ask, well, train 1,000. And so I sit down and I explain to them that that information comes forward, a proposal from the universities or the college about their capacity to deliver more training. That's why our government is assisting Red River College with a new nursing simulation and training center, $12.5 million at Red River College Polytechnic, because nurses need to have the right environment to be able to train. And so it's increase in the seats, it's building the new nurse simulation at the same time. It's adding another intake at College of Nursing. It's incentives. It's a whole host of different strategies, and that we are not making these up as we go along. Mr. Chairperson, I sat with nurses at Health Sciences Center, St. Boniface, Grace Emergency Department, and up in northern and rural communities, and I asked them, what do you think we need to do to bring more nurses into the system and to keep the nurses we have? There was the $123 million for 9 nurse incentives. It came right from the front line. We negotiated these incentives with Manitoba Nurses Union, representing the thousands of nurses. An MOU was signed as an agreement that these are the steps our government needs to take. And so we are following through on what we've heard at the front line in the health system leadership from Manitoba Nurses Union, who signed the MOU and agreed to the strategies. And we are going to continue to move forward with training and hiring and retaining the nurses we have in the system, because we value and appreciate their efforts. And we want to have as a foundation of the work that we're doing, the foundation of ending mandated overtime to ensure individuals have the work-life balance that is so necessary for their overall health, the overall health of their family, and the overall health of our communities, and our provinces. Mr. Chairperson, thank you.
The honourable member for Union Station.
Can the minister share how much is being spent on agency nurses? So the most current available information, most current data on how much is being spent on agency nurses? And does she have a calculation from her department on the average cost of an agency nurse compared to a nurse paid in the WRHA?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for the question. I am able to, I know the member is asking for the average cost of an agency nurse compared to a nurse that is currently working in the public health system. I do not have that information. I would have to take that under advisement. And I don't know, I can't say at this time whether that number would be different by health region, because, for example, if someone in the north may need boarding, they may need remoteness allowance and a number of other costs. So I have to take that back and look at that. But I do have the agency nurse costs, if the member would like that information, the overall for 21-22. Can the member state whether that is in fact something they are requiring?
The Honorable Member for Union Station.
Sure, if the minister can provide that, and then in addition to that, if the minister is able to provide any more current information in regards to agency nurse spending, that would be welcome.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. Okay, so we have I have for the fiscal year 22-23 up until January 31st, 42.9 million, which represents 8% of the total annual nursing salary costs.
The Honorable Member for Union Station.
Does the minister have a sense as to where we are at this point beyond the January 2023 information? Are we on pace to surpass that information? So January... Yeah, if the minister can clarify whether or not we're on pace to surpass those expenditures in regards to agency nursing for that time frame, that would be good information to have. Or does the minister think that we're going to be significantly below that previous spending? I know that the minister may not have a clear number right now in terms of how much has been spent to date. However, I would imagine the minister would be informed as to whether or not we're on pace to surpass that most recently provided number.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. Based on the numbers that I have reviewed, we are not experiencing any increase over last year. So if I'm clear on what the member's question is, for the months of February and March, we are not expecting to exceed the amount that I have quoted or put on the record. And we're projecting to not spend more than we have in the previous year for agency nursing. Thank
you. The honourable member for Union Station.
I thank the minister for that response, and I appreciate that she was transparent about the fact that she's able to see the February and March numbers and what their projections are in terms of agency spending. Can the minister share what those numbers are that she has available to her from February and March of 2023 that they're sort of using to gauge whether or not the projected figures are going to be more or less than the year previous?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I just want to clarify that we're using 22-23 to compare it to 21-22 at that January 31st window. And we're not expecting for 23-24 to see an increase. I just want to be clear on what the years are. We do not have at this moment the 22-23 February and March.
The honourable member for Union Station.
I thank the minister for that answer. I think I've wrapped my head around what she's communicating with me in terms of what they have access to and what they're using to project what it could look like. If I have any other further questions on that, I'll go back to that. I'm going to go back to asking the minister about training spaces. I know that she's directed me to the Advanced Education Department to get clarity around spaces specifically, but you know, something I want to highlight is that, and it stood out to me when I went over the budget, you know, specific to health, and looked at some of those training seats and announcements, that there doesn't really seem to be actually a clear strategy in terms of addressing the health staffing crisis that we have. And you know, the minister and her premier and other folks have talked about 2,000 more health professionals. You know, they throw a lot of numbers out regularly, but there doesn't seem to be a cohesive strategy to address the healthcare staffing crisis across the system, which is very, very concerning given just how bad things are, and given that we continue to actively lose people from our healthcare system to other jurisdictions who are providing more competitive or perhaps you know, work environments that are more conducive to a work-life balance that is sustainable and enjoyable for our healthcare professionals. And so even after concluding a collective agreement with nurses, we know that this minister and her government had to go back with more incentives because the vacancy pressures and challenges with staffing were so significant. The minister talks about having met with nurses and other healthcare professionals, so she knows that nurses have been really pleading with this government for 7 years to stop mistreating them and to stop the attacks on healthcare workers, to stop the attacks on nurses in our healthcare system, who we all call heroes, but this government doesn't reflect that in their actions and how they treat nurses. And so after 7 years of disrespect, you know, of course, nurses are not going to say no to any help or incentives or anything brought forward by this government that they hope might make a positive difference. But nurses have made it pretty clear to me, very clear, that they don't trust this government whatsoever to do what is necessary to repair the damage they've done to our healthcare system. And so I'm wondering if the minister, and I'm speaking specific to nurse training seats that this government has cut historically, how many, does the minister know exactly how many nurse training spaces were cut at post-secondary institutions in the last several years, since 2016, prior to their recently announced increases in training seats? And ultimately, how many nurse training seats were reduced each year under this government?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I want to put on the record that when I met with the nurses, not just at Health Sciences in St. Boniface and Grace, but across the province in rural and northern Manitoba, in my constituency, they come on a regular basis to talk with me about the challenges of getting licensure. I had an individual in my office, I think it was 2 weeks ago, that shared her story of under the previous NDP government trying for 5 years. I can't remember the exact dollar amount that she quoted to get her licensure. And I had someone stop into my office in the constituency last week, and he shared with me in 2001, he came here as a physician wanting to practice his profession of a physician. And I'll tell you, I have people sobbing in my office from the days of the NDP when, according to this nurse, he's now a nurse, no one helped. And the individuals that I've been speaking with have been talking about how much the compliance order that was signed by myself and our government last year has helped internationally educated individuals who felt like they had no hope whatsoever of getting licensed in this province. Two nurses from India approached me at an event and said they were sharing an apartment in Ontario where they were driving from Winnipeg or from Manitoba to Ontario to pick up shifts because they couldn't get licensed here, and how much the simple signing of a compliance order, which members in the previous government never did, has helped them to be able to practice. They're both actually now licensed here in Manitoba and have given up that apartment in Ontario. So when we're talking about respecting nurses, I want to say that the stories I've heard are stories of complete disrespect, that these individuals were not listened to. There was no sympathy from the previous government, and no attempts whatsoever to work with the college to modernize their pathways for licensure, to create new opportunities for English language attestation as we have. And so the stories I was hearing, which I will not repeat because I promised the nurses when I met with them that they weren't going to see their stories on the front page of any newspaper or on my social media platform. In fact, I never even put on my platform that I met with any nurses. I know others did, but I committed to them that I wanted to have a space where they could share with me their experiences, and their experiences were under the previous NDP government, and that nothing had been done, and that in fact the pandemic had exacerbated and showed the gaps in the system. And again, they shared with us what they felt we needed to do as incentives to begin the process of healing. So our healthcare employers are committed to reducing reliance on agency staffing through initiatives to improve retention of nurses currently working in the health system and recruitment of new nurses into positions in the health system. And again, I just want to say these challenges are not unique to Manitoba. Some initiatives in progress to retain our current workforce and to recruit more nurses into positions include mentorship programs, establishing a provincial float pool, and again, the 9 incentives. And I also want to point to the recently negotiated collective agreement with the Manitoba Nurses Union, which also has a number of new provisions intended to increase recruitment and retention of nurses, including creating short-term locum travel for nurses to support staffing needs in northern communities, and forming a new patient care optimization committee with the MNU. So a number of things are underway, but I certainly don't...
The minister's time has expired. The honorable member for Union Station.
I think that the minister really doesn't want to get into a back and forth about mistreating nurses. I don't think the minister wants to get into a back and forth about inactions of her government as it relates to nurses. This minister's government has been in power since 2016, cut healthcare to the bone, fired hundreds of nurses, forced them. And I see members of her caucus here shaking their heads, which is disappointing because I know the nurses who walked down into tunnels, whose jobs were deleted, and had to compete with their friends to find new jobs. And, you know, members in this room of the PC caucus can say that what I'm saying is garbage all they want. I'm sharing the lived experiences of nurses in our healthcare system who are directly impacted by the mistreatment of this Conservative government. You know, including Indigenous nurses who had to fight really hard. And we stood with those nurses because under this government, they couldn't practice. Born and educated in Manitoba. And so, you know, it's long overdue that this minister and her government be accountable for the mistreatment on their end since being in government of nurses. That's a great place for this government and this minister to start. If they start doing that, finally, after all these years, perhaps then nurses might begin to start contemplating being able to trust this government. But as long as this Minister of Health and her government and her colleagues in this committee room who want to have strong reactions to the truth that I'm sharing about the experiences of nurses, as long as they want to continue to deny accountability and to not be held accountable for their actions and mistreatment of workers and nurses, things will not improve. Accountability is the starting point. It's disappointing that yet we continue to see that lack of accountability from this government and from members in the PC caucus. Now, at this stage, you know, I think it's really important that we get clarity on what the impacts of those nursing training seats being cut has had. So I'd ask the minister again, what has been the impact over the past 6 years of this government's cuts to nursing training seats in post-secondary institutions?
Order. I think we should order. I believe that we should order. 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 I believe we should concentrate on the estimates books for questions and quit bantering back and forth, because that's not going to solve anything. Things were going very smoothly, and I would appreciate that we could get back to such a tone. Thank you. The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I do agree with you that we are here to look at the estimates, supplement to the estimates of expenditure for budget 23-24 for Manitoba Health. I'm happy to get back to questions related to it, but I do want to put on the record that health is the employer. Shared Health, all the SDOs is the employer. And we hear on a regular basis from health system leaders and frontline workers about the needs. And I work very collaboratively with the minister responsible for advanced education, because that's where the training seats reside. They have developed the skills, talent, and knowledge strategy that lays out the roadmap for addressing staffing shortages. We have also developed the Health Human Resource Action Plan to bolster their efforts in terms of addressing retention, training, and recruitment of positions that we have been told are critical to the sustainability of the health system. So I will once again have to direct the member in terms of the question of how many nurse training seats may have been reduced or added over the years to the Ministry of Advanced Education and to the Department of Advanced Education's estimates. Thank you.
The Honorable Member for DePauw-Kamisak.
Thank you, Mr. Chair. Thank you, Mr. Chair. As the MLA for the DePauw-Kamisak and somebody who lives in the north, I know how stressful and how it can be complicated to attend a doctor's appointment in Winnipeg. First, you gotta get childcare. First, you gotta make sure that there's enough food while you're away. Gas, hotel, meals. It's very stressful as a northerner to have an appointment with a specialist here in Winnipeg. And I remember in 2016, we were all hyped up because the Paw Clinic was going to be built. And I seen actual documents. Basically, the shovels were ready to hit the ground. However, that was cut by you guys. Now, we don't have space for specialists, and we still continue to stress out when it comes to attending medical appointments. When all those factors, or some of those factors, can't be solved, well, we miss our appointments, which means we're going to get sick, even more sick, perhaps death. And so that's really, really concerning. And guess what we have to rely on? The Northern Patient Transportation Program, which is pretty cheap. It hasn't been touched or looked at since 1995. We should really look at it instead of, like $15 a day for meals. That's impossible. Some folks, I get a lot of complaints at my office about that, saying, how disrespectful, we're treated like children, just given change when we have to come for major appointments with specialists. Now, is there a way that this Northern Patient Transportation Program can get more dollars so we can be treated with respect and as people, instead of just giving change and saying good luck getting there and good luck getting back? So that's my question for the day, is the Northern Patient Transportation Program. Please, we need more funding in that area, since the Paw Clinic specialists space was gone. So we still continue this dread to come to Winnipeg to receive medical attention. Agusa.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for the PAW, Cami Sack, for her comments. One of the areas of priority for our government is ensuring individuals receive care closer to home. And that is why we have the Clinical Preventative Services Plan and have committed $812 million, and a significant portion of those monies will be used in the creation of a new intermediary healthcare hub in Northern Manitoba, and teams are engaged with Indigenous leaders and stakeholders to help lead the COLE plan for these projects. Excuse me. I also want to touch on the members' comments about the Northern Patient Transport Program. So our government has more than doubled the NDP's funding of the Northern Patient Transport Program from $7.9 million to $18.1 million since we took office. So there has been a change. And nearly 20,000 patients a year rely on this program. So we want it to be a program that meets the needs of people living in the North. And we are committed to ensuring that it's properly funded. I know the member was talking about people saying that they were just receiving coins or for their meals, $15. I will certainly take that back to the department to look at what those rates are. But I can say that we have doubled our funding to that program. Thank you, Mr. Chairperson.
The Honorable Member for DePaul-Camisac.
Well, I just, thank you, Mr. Chair. I just want to put on record, you may have doubled, but the rates have to increase. So I just have to put that on record. Agusa.
Things are really tough now for allied healthcare professionals. We've lost a number of paramedics who have walked away from their jobs, either altogether, not working in paramedicine any longer, or have left to other jurisdictions like Saskatchewan because they earn more money there, because they're allowed to practice to their full scope. Whereas in Manitoba, if you work in a rural community, you're not able to practice as a advanced care paramedic. Allied healthcare professionals are critical to our healthcare system being operational, functioning in any capacity whatsoever. And they've unfortunately been mistreated for several years now under this government and this minister's decision-making. They represent over 6,500 professional and technical paramedical workers in the healthcare system. The minister is well aware of that. I'm wondering if the minister is surprised, given what she knows, we all know is going on, the challenges that allied healthcare professionals are facing, not having a contract for 5 years, having their wages frozen by this government at one point even. Is the minister surprised that she can't find people to fill vacant positions when folks like perfusionists, as a good example, are paid 40% higher in their wages in other nearby provinces? Is the minister surprised that she can't find people to fill those positions when there are better financial opportunities elsewhere? And my follow-up to that would be, has the minister met with the Manitoba Allied Healthcare Professionals leadership, and if not, why not?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I know that the member for Union Station is aware that MAHCP is in active bargaining. They are at the table undergoing negotiations, and I'm confident that the two sides will be able to reach a fair and equitable collective agreement. It would be inappropriate of myself as minister to insert myself into a bargaining process. I do, however, want the member to know that Allied Health Professionals is part of our Health Human Resource Action Plan. So commitment of $200 million to add 2,000 additional health professionals. Under my direction, members of the Health Human Resource Action Plan Task Force has been in discussions with MAHCP with regard to the incentives we committed to making available, not just for nurses and doctors, but also allied health. So I look forward to seeing the outcome of those discussions. Thank you.
The Honourable Member for Union Station.
So just to be clear, I'm wanting to know if the minister has met with, rather, the Manitoba Allied Healthcare Professionals leadership. So I'm not asking if the minister has interfered with anything that's going on. I'm asking if she's met with the leadership that represents, the over 6,500 professionals who we depend on to provide quality healthcare to Manitobans. And I also didn't get any clarity as to whether or not the minister is surprised that she can't fill the vacant positions in allied healthcare, given the fact that they are able to earn greater incomes in other jurisdictions and a better work-life balance.
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I can confirm, and I don't have the date available, but I could take that under advisement and bring that back for the member that I have met with MAHCP since becoming Minister of Health. I can also confirm for the member that under my direction, the Health Human Resource Action Plan Task Force is in current discussions with MAHCP regarding incentives that were committed to under the Health Human Resource Action Plan. Happy to meet with MAHCP in the future. I always say to groups that want to meet with me that even when my door is physically closed, mentally it is open to anyone to come and meet with me. Happy to meet with them after their negotiations have concluded and the bargaining process has produced an outcome of a new collective agreement. More than happy to have them stop by for a meeting. Thank you.
The honourable member for Union Station.
Can the minister explain the current organizational structure and the relationships and responsibilities of the provincial health department, shared health, and the regional health authorities? I understand that AFM and the Manitoba Adolescent Treatment Center, so MATC, have been taken over by, I believe, well, it's either Shared Health or WRHA. So can the minister explain the current organizational structure, the relationship of responsibilities between them, and who it is exactly that's taken over the control and responsibility of AFM and MATC?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Union Station for the question because it gives me an opportunity to place on the record that yesterday the leader of the opposition in his debate with the Premier said that nobody can explain the benefits of shared health and vowed to cut their funding. Mr. Chairperson, the arrogance and disrespect the leader of the opposition showed the more than 18,000 shared health employees is astounding, and he should apologize to them. It may not be important enough for the leader of the opposition to look into, but it is important to this government. Those benefits he dismissed are Manitoba's provincial hospital, the Health Sciences Centre, all of the frontline services it provides, and the dozens of specialty services. Why does he want to close down Health Sciences Centre that has transitioned to shared health? Here are some other program areas. Addictions Foundation of Manitoba, the Children's Hospital at HSC. He wants to close down the Children's Hospital at HSC. Manitoba's Addiction Services, Selkirk Mental Health Centre, Diagnostic Services in Manitoba, Emergency Response Services in Manitoba. These are all transition to shared health, where the leader of the opposition vowed to cut their funding. Which of the services is the leader of the opposition planning on cutting? How many of the 18,000 shared health employees is he planning on firing? He should be transparent to Manitobans. Does the member for Union Station know? It would be helpful to be able to answer the question, because these are important areas to healthcare in Manitoba, and they're important to this government. So I have shared the programs that transition to shared health, the same programs that the leader of the opposition vows to cut. And so where would it be? The Children's Hospital at HSC? How about Selkirk Mental Health Centre? Which one and why? Why close or cut funding to our provincial flagship hospital at Health Sciences Centre, the same hospital that our government has been working so hard to add supports to, ensuring that the frontline staff are heard there? Is the leader of the opposition, perhaps the member for Union Station knows? And that is why the question is being asked about which program specialty services have moved to shared health. So as part of transformation, programs were moved from being separate entities that were funded separately to being under shared health. Manitoba's Provincial Hospital, HSC, Addictions Foundation of Manitoba, the Children's Hospital at HSC, Manitoba's Addiction Services, Selkirk Mental Health Center, Diagnostic Services in Manitoba, Emergency Response Services in Manitoba. The aim of shared health is to plan provincially and deliver locally. And these agencies were identified through a lengthy process of transformation and working with frontline staff in terms of which agencies would transition to shared health. So it's not taken over. The Children's Hospital is still called the Children's Hospital at HSC. Selkirk Mental Health Center is still called Selkirk Mental Health Center. Emergency Response Services in Manitoba is still called Emergency Response Services in Manitoba. And I just want to, I know the member was not an MLA at the time, but the transformation work was the outcome of a report that was commissioned by the NDP, and it was the Peachy report. These changes have been made based on a report that the NDP commissioned. And once again, I want to state very clearly for the record that no organization has been taken over. They still bear their names. They still have staff, 18,000 to be exact. And I just want to know, when I hear a statement like that from the leader of the opposition, who's going to be cut. And
The honorable minister's time has expired. The honorable member for Union Station.
That was quite the response. That was something from the Minister of Health. Fascinating response for sure. A lot of reaching in that reply. But I could tell the minister was trying to find a way to burn through 5 minutes. So I think she achieved her objective in her response there in that regard. So I do have a couple of additional questions. I'm hopeful the minister will provide a response to my questions. And I do want to state again that allied healthcare professionals are incredibly valued. They're invaluable to our healthcare system, and it is a shame that the over 6,500 allied healthcare professionals in Manitoba have gone, over 5 years without a contract. They've had their wages frozen by this health minister and her government. We've had folks leave the careers they love because they are burnt out, exhausted due to vacancies that haven't been filled. Like paramedics are a good example of that. Perfusionists who've left Manitoba because they're able to earn 40% more in other jurisdictions. We know that right now, allied healthcare professionals are exploring the option of a strike, which is incredibly disheartening. These folks have all navigated a pandemic that was incredibly difficult for all of us across the province. Certainly they bear the brunt of that in healthcare, continuing to provide the care that Manitobans need. And that should have been met with a government who had their backs and supported them, not a government who continued to mistreat them and not hear them or listen to their expertise, not a government who would instead, resist providing an adequate and fair package by way of a deal. And it shouldn't take allied healthcare professionals getting to the point of maybe striking for their voices to be heard by this government. It's really disappointing. And allied healthcare professionals and healthcare workers alike across Manitoba deserve better than this minister's leadership in healthcare, and they deserve better than this current PC government. I am going to leave my questions there for today, actually, and I'm going to turn it over to our colleague the MLA for River Heights.
The honorable member for River Heights.
Yeah, thank you. Thank you. Just a question in terms of, and take an example, the Grace Hospital, the relative role of shared health and the relative role of the hospital management. Who is responsible for allocating funds for employers, and who's responsible for hiring and firing the people who work at the Grace Hospital?
The honorable Minister of Health.
I can, thank you, Mr. Chairperson. I can respond that it is the Winnipeg Regional Health Authority.
The honorable member for River Heights.
So the Winnipeg Regional Health Authority is the one which allocates funds and which hires and fires all the people who work at the Grace Hospital. Is that correct?
The honorable Minister of Health.
Thank you, Mr. Chairperson. I can clarify that Manitoba Health allocates global funding to the SDOs, of which one of them is the Winnipeg Regional Health Authority. And then the Winnipeg Regional Health Authority allocates funding to, for example, a facility such as the Grace Hospital for their operations. With regard to who fires people, I mean, I think it depends on the staffing level of that individual. If it's a position that has been appointed to the Grace Hospital by the WRHA, perhaps the WRHA would be letting that person go. If it's a frontline staff, it could be human resources at the Grace Hospital. So it really depends on the position.
The honorable member for River Heights.
Yeah, just to complete that, you mentioned a human resources person at Grace Hospital. Is that person hired and fired by the Grace Hospital or by the WRHA?
The honorable Minister of Health.
Thank you, Mr. Chairperson. I can say again that the WRHA funds the operations of Grace Hospital. A number of positions are hired at various levels. Some may be positions hired through WRHA. Some may be facility hired. I would just like to remind the member that we're here to consider the estimates for 23-24 for Manitoba Health, and I'm happy to answer any questions related to the estimates. Thank you.
The honourable member for River Heights.
Yeah, I mean, a fundamental component of the estimates is how the dollars are allocated and how they are spent. I'm interested in to what extent the minister is involved or knowledgeable or let know what's happening in terms of the situation of employees and so on at the Grace Hospital. For example, I understand that there was a period where doctors were concerned that there was not enough or maybe even no night physicians at Grace Hospital. And I'm just trying to understand when would the minister, when would you as the minister know about this sort of a situation and what sort of input would you have?
The Honourable Minister of Health.
Thank you, Mr. Chairperson. I'm pleased to put on the record as it relates to Grace Hospital that 46 new physicians have been hired and are practicing in Manitoba since we announced the Health Human Resource Action Plan. This includes 30 family physicians, a cardiac surgeon, a neurologist, and a neurosurgeon, among many others. And I'm proud to say that many of these new physicians are internationally trained doctors. Our government has invested $77.1 million into the Grace Hospital. This includes capital upgrades of $63.1 million, safety and security measures, $4.9 million, and medical equipment and upgrades, $9.1 million. The Health Human Resource Action Plan is meant to address many of the issues related not just to nursing shortages, but physician shortages as well. And it's my understanding that the Winnipeg Regional Health Authority has approved the hiring of additional physician resources for the Grace Hospital. And these additional resources include physician assistants and a hospital medical officer for the overnight shift on the acute medicine ward. Thank you, Mr. Chairperson.
The Honourable Member for River Heights.
The minister has talked a lot about the $200 million allocated to address the staff shortage situation and to address problems which may have arisen or may not have arisen during COVID or from before. But the $200 million, I wonder if the minister could provide a breakdown of what proportion of that $200 million would go to, say, address shortages of physicians, what would go to address shortages in nurses, what would go to address shortages in allied health positions.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I'm happy to put on the record the Health Human Resource Action Plan publicly funded initiatives that have been announced, and more work is being done through Doctors Manitoba and the Health Human Resource Action Plan Task Force around incentives. But I'm pleased to say 80 new physician training seats, 40 undergraduate physician seats, 10 international medical graduate seats, 30 two-year post-grad medical seats for internationally educated medical students. We extended primary care patient hours for family and pediatric clinics, a financial incentive for doctors' offices to extend hours so patients can access primary care more readily. 450,000 for physician mental health supports through the peer support program, $5 million for new emergency care service vectors to virtually support patient transfers. And again, I recently announced our partnership with Doctors Manitoba to reduce physician administration by establishing a joint task force to reduce administrative burden for physicians and reduce red tape that we have heard will lead to thousands of hours of physician time being transferred to direct delivery of care. So I look forward to the report that will be coming forward from this task force at the end of the year. So much more work is happening at the table with the task force responsible for the Health Human Resource Action Plan. And I look forward to seeing more great outcomes and being able to stand with stakeholders and share the good news about the discussions that have been taking place. Thank you, Mr. Chair.
The Honorable Member for River Heights.
Yeah, over the last couple of decades, there's been considerable expansion of the dialysis program or programs around the province. I wonder if the minister could give us a number for the total number of dialysis units in Manitoba, and what are the capital and operating costs related to those units for this year.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. This is another request that where the data is owned by Shared Health. The dialysis program is a provincial program that is under Shared Health, so we would need to go to Shared Health for that information. Can the member tell me what the time frame is that, are they asking for this information, the upcoming estimates, the one we're here to consider, 23, 24? What is the timeline that is being asked for?
The Honorable Member for River Heights.
Yeah, I would like to have the numbers for the current year, the estimates, plus also the number for what was spent in the last fiscal year that we have just completed, 22-23.
The Honorable Member for River Heights.
And the number of dialysis units, last year, and if it changed this year.
The Honorable Minister of Health.
Oh, sorry, Mr. Chairperson. Thank you, Mr. Chairperson. We will take this request under advisement and return with a response.
The Honorable Member for River Heights.
Yeah, I know that there has been problems at times with sufficient physicians and nurses in Grandview, and I'm just trying to understand where the bottleneck is, whether it is in recruiting people, whether it is the allocation of funds, and what is the bottleneck for making sure that the emergency room and the hospital are fully staffed.
The hour being 5 p.m., committee rise.